How long after birth should a newborn pass meconium? A. 2 to 6 hours. B. 24 hours. C. 3 to 5 days. D. 2 weeks. The answer is B. 24 hours. Meconium is a sticky, dark green to black stool that is the first stool passed by neonates after birth. It is composed of the content of the infant's digestive tract before it has begun drinking milk, primarily water, mucus, bile, lanigo, and intestinal epithelial cells. A newborn that has begun to feed on breast milk or formula should pass a normal stool, yellow to mustard green and creamy rather than sticky, within 24 hours. The nurse counsels the mother of a 2-month-old infant. Which of the following actions by the mother would be inappropriate? A. The mother makes eye contact when she speaks to the baby. B. The mother places the infant on her back during naps and at bedtime. C. The mother swaddles the child in blankets for naps. D. The mother waits 6 months before introducing infant cereals to the baby's diet. E. The mother lets her cry for 5 minutes before responding if the baby cries at night. The answer is E. The mother lets her cry for 5 minutes before responding if the baby cries at night. Infants younger than 6 months may have trouble sleeping for long periods of time because they awaken from hunger. Their stomachs are not yet large enough to hold enough nourishment to keep them asleep during the night. After 6 months, it is more appropriate to let babies cry themselves and put themselves to sleep, but before 6 months, it is not recommended. The other actions are appropriate. Infants should sleep on their backs to prevent sudden infant death syndrome, SIDS. Babies should be interacted with frequently. Breast milk is recommended exclusively for the first 6 months, and swaddling the child is important because the infant cannot sleep in loose blankets. The nurse performs triage in the emergency department for a patient with a bee sting. The family reports a history of allergic reactions to bee stings, and the patient complains of difficulty breathing and swelling in his mouth. Which of the following is the priority of the nurse? A. Contact the physician. B. Administer subcutaneous epinephrine. C. Obtain a full patient history. D. Maintain an open airway. E. Administer oral diphenhydramine. The answer is D. Maintain an open airway. Follow the ABCs of nursing priority: airway, breathing, circulation. It is most important for the nurse to maintain a patent airway, as the symptoms manifested suggest an anaphylactic reaction. Epinephrine may be given after the airway is established. Oral diphenhydramine is usually given for mild allergic reactions. The physician may be contacted later. Patient safety is the priority. The nurse is discussing end-of-life care procedures with an elderly patient who is Buddhist. The nurse knows that the patient will most likely want to incorporate A. No blood transfusions. B. No autopsy and cremation. C. Prayers to provide support and comfort. D. Time for meditation. The answer is D. Time for meditation. Buddhists will want time for meditation, and may refuse medications that alter awareness. A shrine to Buddha may be placed in the client's room. The nurse cares for an 82-year-old woman with frequent constipation. Which of the following statements by the nurse would be inappropriate? A. It could help to remove dairy products like milk and cheese from your diet. B. Make sure you are well hydrated. 6-8 glasses of water a day would be good. C. You should eat dark green vegetables and whole grains. D. You can take a laxative whenever you want to have a bowel movement. E. You can try light exercise for at least 30 minutes every day. The answer is D. You can take a laxative whenever you want to have a bowel movement. Elderly patients may suffer from bowel problems like constipation due to lower motility in the gastrointestinal tract. The nurse should advise this client to exercise daily, to increase blood flow to the GI tract, stay hydrated, to prevent hard, dry stools, eat more fiber, such as fruits, vegetables, nuts, grains, and beans, and stay away from milk and cheese, as lactose sensitivity is common and may be a cause of constipation or bloating. This patient should not take laxatives each time a bowel movement is expected. Reliance on laxatives is not recommended because it can desensitize the bowel and make constipation worse. An emergency room nurse is assessing a 26-year-old female patient who frequently uses opium. What symptoms would indicate that she is experiencing withdrawal? A. Diaphoresis, seizures, and apathy. B. Irritability, tremors, and seizures. C. Nausea, vomiting, and anxiety. D. Fatigue, disorientation, and craving. The answer is C. Nausea, vomiting, and anxiety. Anxiety, nausea, and vomiting are common symptoms of opium withdrawal. A nurse is monitoring an 18-year-old who is experiencing heroin withdrawal. What symptoms might the nurse observe? A. Seizures, tremors, and tachycardia. B. Nausea and fainting. C. Yawning, cramps, and diarrhea. D. Coma and convulsions. The answer is C. Yawning, cramps, and diarrhea. Yawning, cramps, and diarrhea are common signs of heroin withdrawal. Which of the following drugs is considered a central nervous system, CNS, depressant? A. Marijuana. B. Nalol. C. Cyclobenzaprine. D. All of these. The answer is D. All of these. All of the drugs listed are considered to be CNS depressants. While generally classified as a psychedelic, marijuana has multiple central depressant effects such as sedation and muscle relaxation. Also, alcohol is another commonly used depressant. Alcohol abuse-induced thiamine deficiency can cause which of the following? A. Wolff-Hirschhorn syndrome. B. Lewy body dementia. C. Agnosia. D. Wernicke-Korsakoff syndrome. The answer is D. Wernicke-Korsakoff syndrome. Wernicke-Korsakoff syndrome is caused by a severe deficiency in thiamine, often seen in severe alcohol dependency. It is characterized by visual disturbances, ataxia, and altered consciousness. Wolff-Hirschhorn syndrome is a genetic disorder causing developmental disability and may involve seizures. Lewy body dementia is associated with Parkinson's disease. Agnosia is a neurological disorder causing impaired ability to process sensory information. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, criteria for substance abuse includes all of the following except dash. A. Recurrent substance use resulting in a failure to fulfill major role obligations at work, school, or home. B. Recurrent substance use in situations in which it is physically hazardous. C. All of these are part of the DSM-5 criteria for substance abuse. D. Continued substance use despite having persistent or recurrent social or interpersonal problems caused by or exacerbated by the effects of the substance. The answer is C. All of these are part of the DSM-5 criteria for substance abuse. All of the items listed are part of the DSM-5 criteria for substance abuse. In addition, the individual's symptoms must not qualify for substance dependence, and recurrent substance-related legal problems are other DSM-5 criteria for substance abuse.